today we're going to discuss small incision lenticular extraction, or SMILE. In this video, I'm going to discuss some things you should know before undergoing SMILE. So what is SMILE? This is an elective surgery for the correction of nearsightedness and mild astigmatism, and it was approved by the FDA in 2016. It works by changing the shape of the cornea, and by doing this, they use a femtosecond laser or an ultrafast laser that's also used in LASIK. However, the lasers are used differently in the two surgeries. Prior to the surgery, an antibiotic and an anesthetic eye drop will be placed in the eye. Using the laser, a thin lenticule or 3D shape of tissue is cut from underneath the corneal surface. This allows for the strength of the front of the cornea to be preserved, and the shape of the tissue removed depends on the amount of nearsightedness or astigmatism that's being corrected. The tissue is removed through a small peripheral incision that is smaller than the LASIK incision. This is about 2 to 5 millimeters. After the lenticule is removed through the incision, the cornea is either more flat in the case of nearsightedness or rounder in the case of astigmatism. Overall, it takes about 10 minutes per eye. In most cases, vision is instantly better than before the operation without glasses. Vision's about 80% improved on the first day, and it's about 100% to what it will be at about 1 week. So which patients are right for SMILE? To have this refractive surgery done, we recommend the patients being at least 22 years of age and that your eye prescription has not changed for the past year. We can correct nearsightedness between -1 to -8 diopters and an astigmatism of up to -3 diopters. We also want our patients to have a healthy cornea, which is the refractive surface of the eye. And lastly, we want them to have an understanding of realistic expectations as a result of SMILE. So which patients should not get SMILE? Patients with uncontrolled vascular or autoimmune diseases, patients who are immunocompromised or taking medications that compromise the immune system, also patients that have diseases that impact wound healing, such as uncontrolled diabetes, as well as active eye diseases. This would be eye diseases other than nearsightedness, farsightedness, or astigmatism, patients who have a progressive or changing vision prescription, and patients with uncontrolled glaucoma, dry eye, and blepharitis. And what are the limitations of SMILE? So glasses, contacts, and additional refractive procedures may still be required to achieve optimal vision after SMILE. And a patient still may need to wear their glasses or contacts after SMILE, although likely they'll have a more mild prescription. SMILE does not stop the natural aging process of the eye. This includes glaucoma, cataracts, macular degeneration, and presbyopia. So what are the risks during surgery? Some of the risks include suction loss, reported as 0.4 to 6% in the literature, and epithelial defect, 2 to 5%, difficulty with lenticular extraction, 1.5 to 9%, wound bleeding up to 7%, and very rarely infectious keratitis. Some post-operative risks to consider with all refractive surgeries would be loss of vision, residual nearsightedness, farsightedness, and astigmatism. Also visual side effects such as glare, starburst, halo, and difficulty driving at night. Epithelial growth can occur under the incision of the cornea, which can cause an astigmatism, foreign body sensation, double vision, or diminished depth perception. Also, up to 56% of patients do experience dry eye, but this tends to resolve within 3 months. Other risks to consider is the risk of keratoconus, or an irregular corneal shape that can occur in up to 0.5% of patients. In very severe cases, this may lead to the need for a corneal transplant. Corneal ulcers can form in up to 5.5% of patients, and diffuse lamellar keratitis or inflammation of the cornea can occur in up to 0.04 patients. Patients can also have contact lens intolerance, clouding of the cornea or scarring, retinal detachment, and cataract formation, although rare. And because this is a relatively new technique, there might be long-term complications that we're not aware of at this point. So what should you discuss with your physician before SMILE? Pregnancy can change the refractive error and curvature of the cornea due to changes in hormone levels. It can also slow down the healing process. We suggest that you should not undergo SMILE if you are planning to become pregnant within 6 months of the procedure, currently pregnant, or breastfeeding. You should tell your physician what medications you're taking so they can account for the risk of allergic reactions or drug reactions. Hard and gas permeable contact lenses must be stopped 3 weeks prior to an initial examination for SMILE. Soft contacts should be stopped 3 days prior, and no contacts should be worn 24 hours prior to surgery. Don't expose your eyes to non-sterile water such as shower water or bath water after surgery. Make sure you wear sunglasses outside, do not rub your eyes, and if you're going to participate in a contact sport, wear protective eyewear. On the day of your surgery, please arrange for a driver and also arrange for a driver for your follow-up appointment the next day. Please do not resume operating a motor vehicle until your vision is adequate to do so. Patient discomfort varies with this surgery. Your eyes will be sore after SMILE, and the cornea may be swollen, which can cause some blurry vision for up to a week. This concludes the informed consent video on small incision lenticular extraction.